Welcome to the Bob Priest Show of Life podcast. I'm your host, Bob Priest. Thanks for tuning in to today's show. My guest today is Dr. Lee Matthis. Hi, Lee. How are you today?
Hey, Bob. I'm doing well. Thank you.
Great. Lee is the Vice President of Clinical Development and Professional Outreach. He is also responsible for innovative clinical improvements for improving patient care, overall doctor development coordination, professional outreach, and speaking. He is a graduate of Campbell University, Doctor of Chiropractic Degree from Palmer College of Chiropractic. He's received many honors, including graduating from the National Outdoor Leadership School in Lander, Wyoming, prestigious Vogt, I don't know if I say this right, is it Vogt?
Vogt Leadership, yes, sir.
Leadership Society Award, and the Virgil V. Strang Chiropractic Philosophy Award from Palmer College. He also serves as Team Chiropractor and is honorary member of the Virginia Tech cycling team. Welcome.
Thank you, Bob.
Sounds like you're a busy guy.
I guess I am. The more you keep reading, I thought, man, do I do all that? Wow.
And you do stuff every day in your office.
I save lives every day. I do indeed.
Well, that's awesome. So, I'll tell my audience, I'm a little biased of having Dr. Lee on with us tonight because he's my chiropractor. And back prior to meeting Lee, I had gone to the same chiropractic practice with another gentleman, but that gentleman moved out of the area. And so I was left stranded, and my daughter introduced us, and love going to you. I feel better every time that I walk in, and I feel better, even better when I walk out, because this guy's a funny guy. You may hear some of that when we get into our conversation today. But Lee, it always intrigues me when I talk to the different guests about what brings you to what you do today. What brought you to this practice that you do today?
That's a good question. So when I was 6 years old, I decided out of the blue that I needed to be a general and vascular surgeon. I grew up in eastern North Carolina. My dad was on the Bass Pro Tour, and he fished. We quail hunted, we rabbit hunted, deer hunted a lot, and we were outdoorsmen. We made a good meal or three a week out of things that we had harvested from the woods or the lakes and ponds. So, the rule in our house was if you kill it, you grill it. So all of the animals that we shot and caught, we would fillet and clean and gut. And I was just enamored as a child, how the biomechanics of animals work. I thought that was really, really cool. I decided that, hey, how can I translate that? And again, these are 6-year-old thoughts. This is my look back in time, but how can I do something like that all the time and have fun and help people get paid for it at the same time? When I was 11, my dad had a dear friend who was a general and vascular surgeon who, back in the early 90s, invited me to scrub up and go into the operating room.
How cool.
And yeah, it was definitely a life-altering experience where I was able to watch healthcare performed at a very, very high level. I helped place patients. Kind of funny that at 11 years old, I saw a full hemorrhoidectomy. 39-year-old gentleman.
Wow.
I never batted an eye. It was all anatomy and physiology. So I planned on continuing on a career to become a general and vascular surgeon. Well, good Lord had different plans, and my senior year in high school, my grandmother actually passed away during a routine operation. And, that kind of struck me pretty hard. The surgeon was not at fault. It was just her time. There was nothing anybody could have done. It was a tortuous abdomen situation. And she was gone before she could. But I felt like there was apathy from the surgeon. like, you lost your grandmother, I'm sorry, wish you the best. And then he had to go on about his life. And I've come to learn that he had to do his coping mechanisms just like I had to, grieve and do mine as well. But that really struck me as something that I did not want to participate in on a very frequent basis. I don't really, I'm not drawn to the death and dying aspect or end of the spectrum. I like to make those feel better. Bob, in your case, be more handsome. So, I was drawn to something else. So I went on about the business, went in, continued to do pre-med biology in undergrad. During my sophomore year, I took 3 months off, moved out to Wyoming, went to the National Outdoor Leadership School. And then when you're 50 miles away from the nearest paved road, you have a lot of time to think, and just listen and hear what the world's universe and God are telling you. And chiropractic just kept coming up. So when I got back from my excursion, I had a really long beard, I lost a lot of weight, and I started looking at chiropractic school. Again, on the other end of the spectrum, from a preventative or a maintenance type approach to healthcare, as opposed to very reactive, the downward spiral that the healthcare system can turn into at times. So that's kind of fell in my lap. Went to chiropractic school, and I've been right here in Christiansburg, Virginia for 16 and a half years. Graduated, right here, went to work.
Well, my family's glad we've met you. And, I had a stroke a few years ago, and I thought at that time I was in pretty decent health until obviously I had the stroke, and something internally was obviously going on. But it changed my thought process, especially when I was thrown all this medication to take care of the various and sundry things that came up from that stroke, or were coming on prior to that stroke even. And boy, I didn't like that. A lot of those things had adverse reactions to my body, had adverse reactions. I had aches and pains I'd never had before, and so on. And I started researching holistic alternative methods, which I think chiropractic falls under, because it's such a different type of practice than going into your doctor, being told to go to a physical therapist because of this, that, or the other. One of the things that I like about what you do and your practice does is you actually sit down with your patient for a very extended period of time, and you go through a litany of questions. We actually sit there and fill out places on a chart where our bodies are affected or are bothering us. Tell us a little bit more about that approach in your practice compared to maybe the medical field that we normally are used to seeing.
Okay. In our clinic system, we practice something called episodic care. And an episodic care model means that the majority of patients who come see me come in for one or two things. Something hurts typically. There's a pain threshold that has been breached, and they just want to feel better. In order for me to figure that out, I've got to find out what tissue they can be hurting, what's causing it, what's perpetuating that pain. So it is more of a what we call a psychosocial, biopsychosocial model that we will sit down and say, what biology is actually hurting? What is causing your pain? What are the psychological factors? You have a heavy amount of stress. I have 3 patients on this table today who are getting married this weekend. And every one of them, ears and shoulders were coming together, and there was just so much tension due to the mounting stress of this upcoming wedding that each of them get married somebody different. So it's 3 different weddings. So there's a psychological aspect. Then there's a social aspect as well. Meaning, how are you? Where do you work? What does society have you doing that would perpetuate some of these pains? So it's a more holistic approach than, oh, my elbow hurts. Well, let's mash. Does that hurt? Okay, well, you have an elbow problem. We do that, but we also want to say, is this truly the problem, or is this a side effect of something else going on? Is it a total pattern? Is it a radicular pattern? And we try to chase down the source or the cause of a patient's presentation and chief complaint. We work after we do our holistic assessment. We do an examination. We work through various pathways and channels to meet the goals of the patient or get as close as we can. And when we get to that end goal, we shake hands. I've done the best job I can, and I appreciate you trusting me with your help. And then we part ways from the episode, if I'm saying that in quotations, because chiropractic also has a foot in another side of healthcare, which is preventative and maintenance care. So we've done a really good job meeting a patient's goals, building trust and rapport with that patient. A lot of patients choose to stick around, and very similar to your car. If you want to maintain your car for a long period of time, you'll change the oil. You'll rotate your tire. You'll make sure that you flush your fluids and all that stuff. Chiropractic can be used in that preventative type manner as well. So a lot of our patients stick around on the prevention side. So we kind of have a really neat foot in each of the allopathic and symptom-based world, and also in the holistic, maintenance wellness, preventative world as well. We've come at the approach in a very similar fashion to see where we need to work the patient's best benefit.
That's a great explanation. It kind of even reminds me when I came in last week, and I really came with my wife because she was having some major problems. And I didn't think I really had very many pains. Nothing was bothering me. I was feeling pretty good. However, I found out that my hips weren't lined up. And not that I had any significant pain, but I've noticed that just in the 3 or 4 times now that I've been in since that initial consultation, I feel totally different. And whether I had pain or not when I initially started, I definitely feel better, and I feel more agile today. By the way, I had a meeting with Dr. Lee this morning, so I've been through this just recently. But what are some of the top challenges you in the chiropractic field face today?
I would say for me, I'm going to answer that two ways.
Okay.
From a doctor-patient standpoint, one of my biggest challenges, and I think this goes for most manual therapies, physical therapy, PM&R doctors, orthopedists, the hardest challenge that doctors have, that I have with patients, is compliance. A lot of times I know what the patient needs to get their goals met, but the patient has a life going on with other priorities over their health. Sometimes it's finances, sometimes it's time, sometimes they're pulled in 19 different directions. So I'd probably say that compliance with recommendations is one of my biggest hurdles as a care provider for patient care. On the other side of that, we chiropractors have been for a long time fighting a really, really interesting ignorance of what we do. I've had the CEO of a hospital system look me dead in the eye and say, I wish we could send more patients to chiropractors. We just don't know what chiropractors do. We don't know what we're going to get when we send a patient to a chiropractor. Our scope of practice is very broad. Again, we're very holistically minded. So some chiropractors do acupuncture, some do nutritional counseling, some do bracing and orthoses, and some run a fairly close to a therapy center. Others do very straight, just chiropractic adjustments with very little else going on. So there's a broad swath of what chiropractor can shingle, his preferred shingle, and still call chiropractic. So there's an ignorance both from the allopathic world and the general public as to what type of practice what type of chiropractic practice they might want to go to, or they might want to refer a patient to. So that's one of my biggest hurdles that we're trying to make strides in Southwest Virginia to overcome.
Yeah, and I would agree with that, because I've been to several chiropractors over my lifetime. With the first one there in Christiansburg, 30 years ago, when I really did some damage to my back, and I crawled into the office and actually walked out. And after a couple of weeks, stood up straight again. And so I became a believer in what you do. But I have noticed that throughout that time frame that there's different approaches. Your approach is very different than what I've been used to coming across in the past. You're very methodical with your thought process. And I like that because I like to ask questions, and I like to know what you're doing and why you're doing it. And so that makes a lot of sense. So you kind of already answered this question, but I'll bring it up again because maybe we can expand even more. But what are some of the things that differentiate you from other chiropractors in the area or around a broad community? What really differentiates you from the rest of the world?
I really want to get out of the office tonight, so I can't have my head swell that big now. I don't want you to.
Well, now I know you're from North Carolina, and
That's right.
Things come out slower and longer, but
I'm drawing my words out. One of the things that I have been blessed with is I work in a clinical setting. I work in a group of chiropractors who are very supportive of one another. We bounce a lot of stuff off of each other. I had a younger doctor today was having some issues with some FMLA paperwork. She said, "Hey, can you kind of walk me through this?" I would love to. I've done hundreds of those, and I'd love to help you out so that you don't have the same, frustrations that I did having to learn it the way I did, failing my failures. I like pointing that out. So I have that. I've been very blessed to be in a group that is open to being very collaborative. My boss is one of my dearest friends and has a really, really, really big vision for what our profession can do, what role we can fill in healthcare. And several years ago, he sent me to the University of Pittsburgh to undergo a postdoctoral certification. I'm now a primary spine practitioner through the University of Pittsburgh's physical therapy school. I'm not a physical therapist, but one of the things that I learned through this school is a very interesting and very replicable approach to musculoskeletal pain, in that me, a physical therapist, any of the PSP, primary spine practitioners, can take a patient and come to the same conclusion and have a pathway of how to get the best outcomes for that patient in the most efficient time for the most efficient cost. And that has been something that I think would actually help me stand out in the area versus other practitioners. But again, in that collaborative model, I have started trying to work with some of our other doctors to see if we can replicate that in our internal system. I don't want to be the best there ever was. I want to be the one that helps everybody else become the best they were. I was a teacher before I went to grad school, so that's kind of my burning desire is I want to take what I've got and hopefully elevate the entire profession by passing that on to other folks. And we've got a really, really good group of doctors I get to work with, and they're open to taking some of that information and implementing their patients so that the ships are rising with incoming tides. It's kind of fun.
Yeah, that's awesome. That's awesome that you want to do that and broaden that field. I'm sure you've had some pretty interesting situations come in your office. Is there maybe one that sticks out in your mind that you could share of a client, a patient that came in this way and left that way, and how it all came about?
I've got two right off the top of my head. One's very quick and easy, and I've done this several times. But the first time I did it was very interesting. I had a young lady from neighboring county who came in. She had two children. Her youngest child was about 3 years old. From the time she had been pregnant with her second child, she had not menstruated. So you're looking 3+ years that she had not had a cycle. She also wanted to have more children. She tweaked her back a little bit at a church outing. She came in. She had some church members that had seen me in the past. They go to Dr. Matthis to take care of me. And she came in. She was telling me, this, and this. We worked her through our consult exam. We adjusted her, and the next time I saw her was a couple days later. She came in. She was beaming, And I had not realized it when we first met. She was very patient. Her skin tone was just very sickly. And I'm not trying to be ugly. Her color was just not good. We adjusted her. A couple days later, she comes in. She's just got this glow to her that I hadn't seen before. I thought it was really neat. Following week, she comes in and she said, "I don't know what you've done, but I have been having one of the heaviest periods of my life." And she said, "I've actually called my OB to find out if I'm hemorrhaging, if I need to be checked," and she hadn't. And I treated her back, was feeling much, much better. So we released her from her episode of care, 3 or 4 weeks of care. And she called about 2 months later and wanted to just come in for a maintenance visit. I said, "Please come in." So she came in to get adjusted, and she was about 2 weeks pregnant. She was taking a pregnancy test. And again, the power that made the body heals the body. I didn't do anything special. But when I got in and worked to try and make her back feel better, the nerves that went to her uterus cut loose, and all of a sudden she could ovulate here and again. They have 6 children now. So thought that was
the population quite well.
I don't know if that's a good thing or not, but it worked.
That's an interesting story.
The other one is a similar story, and again, it goes along with what the patient has going on that I don't know about. Even as holistic and thorough as I attempt to be, I had a gentleman come in years ago on a referral from the Veterans Administration, and he had horrible headaches, the kind of headaches that ice pick headaches that he had scars on his head where he would hit his head repeatedly against the wall until he would bleed, because it took his mind off the excruciating pain in his neck, in his head. He had a lot of degenerative changes in his lower spine and his lumbar spine. So we were actually working on his lower back, but he also screamed out, was okay to be adjusted. So I started adjusting his neck. His headaches did not improve a whole lot. He was very, in the disability world, he was fairly high score on the disability charts that we used, or outcomes that we used. His lower back started improving a little bit. His wife actually came in and became a patient as well. So all of a sudden they dropped off. I called and left a message. I hadn't seen him in a week or so. I called and left a message at the house and I didn't hear anything else. And so I called one more time, didn't hear anything else. And I thought, well, I hope everything's okay. But I don't want to pester these folks. They might just think I smell bad. I don't want to see anyone. 2 or 3 months later, his wife came back in and I said, "Hey, how are you doing? I hadn't seen you. I hope everything's okay. How's Joe?" She busted into tears. She said, "Well, Joe's in the hospital." "Sorry to hear that. Is he okay?" She said, "You have no idea how much better you made him feel. It was so bad that his head was hurting. His head typically hurt so bad that he would talk like he wanted to do self-harm, and he'd never done it. Well, when his head started feeling a little bit better and he could think about other things, his legs started hurting, to the point that he took a pistol shot himself to take his mind off. A lot of PTSD, a lot of psychosocial factors going on, but Joe shot himself in the leg because it hurt so bad." She said, "I just thank God that you have taken his mind off his head just a little bit, because who knows where he would have got himself if his head still hurting that bad." So we approach patient care thinking that we're going to fix somebody's neck or their back, and oftentimes we might have a little bit of an impact, but we don't really know how much of an impact until we have the opportunity to kind of wash things out a little bit. So,
Well,
I hope it wasn't a Debbie Downer story, but again, it's just one of those I keep in my mind.
But I think something too that we can learn is that, this is one area that a lot of people neglect, is they don't try to take care and maintain their body, the little minor things, so that when one day when the big stuff comes along, it may be so far gone that you only get minimal relief at best. So I'm very encouraged by holistic alternative ways, acupuncture, chiropractics, at helping our bodies help heal themselves. And when you take that pain away, or when you get things back in alignment, our bodies have a fighting chance to do what they're supposed to do. So real quickly, you're from North Carolina. You're a fun-loving guy. So what's some of the most enjoyable things you like to do outside of the office?
I thoroughly like hanging out with my bride. She's just a special person because she's put up with me for so long. So we like holding hands and walking the dogs around the neighborhood. I really love flying kites. Actually, I'm a kite pilot. I have 2 kites in the car right now just in case the wind is blowing. I'm an aspiring paraglider pilot. I want the kites to fly me as well. And just being out in the great outdoors. I love hiking. I like being on water, be it a river or lake, or I grew up an hour from the coast. I'm known to do a little surf fishing and surf as well. So
that's really neat. We have 2 gliders that go across our house quite frequently out here.
I hope to be in one of those soon. I have a ride set up. So
well, they in the evenings, because usually the golfers are off the golf course out here, and usually they'll do a dive down on one of the fairways, touch their feet to it, and go right back up. It's really cool to watch. But so, you're a very learned gentleman. I thoroughly have enjoyed getting to know you. And so I think you ought to match a book title with what you love doing, your outdoors experiences, along with your practice of chiropractics. So I want you to be thinking about that. Every time I have a guest on, I usually, in our conversations, will hear a book title, because I think, with what you do, with the way that you're approaching the world of chiropractics and the holistic, I think that you have a book inside of you. And, maybe it's outdoor chiropractics with Lee, or or something of that nature, but it's something fun. I think we'll work on that. We'll talk about that more when I come in your office.
That sounds good.
Hey, as we wrap up, what would you like to share with our audience on how chiropractics could be a benefit towards better overall health, and why?
Sure. The longer I've been in practice and the more time I've spent on this earth, I have realized that, and I've heard this said many, many ways, but I've realized that common sense can be a superpower. The simple things can have the biggest impact. And if you deal with situations or issues out of 1 out of 10, they've never had the opportunity to reach a 9 out of 10. So all 3 of those things kind of wrap up kind of a life philosophy that I've kind of come up with, that has evolved through me. It's a lot easier to prevent something than it is to have to cure something. It's a lot easier to maintain what you currently got than to try and fight tooth and nail and claw your way back to where you want to be. So I think if folks can do any little thing they can to maintain their health, that's all they're ever going to have. So they might as well do a little bit to try to preserve that.
Well, I definitely relate to that after having the stroke and then having to fight back to come back to where I am today. And the good news, between finding wonderful people like yourself in this different world of medicine, holistic, alternative chiropractics, acupuncture, I found some different ways to help my body repair itself without altering it with medications and things of that nature. And I'm not saying that sometimes those things aren't important, but I don't think they should be something that we want to live on the rest of our life. So I really have embraced that philosophy that you just said. I really want to do whatever I can to help my body do what it's supposed to do naturally anyway. And so I thank you so much for your time. I know you've been there at the office all day today, and your left eye's drooping, so you probably want to get home.
That's pollen that's got in it. Pollen as well.
Yeah. Before we let you go, just tell our audience the best way to get in touch with you and how they could reach out. And you're located in?
I'm in Christiansburg, Virginia, the southwest corner of Virginia.
Okay. And
But
give
yeah,
me email and website and all
Sure.
that kind of stuff.
Sure. The website is www.tuckclinic.com. That's TUCK clinic.com. My email address is lmatthis, MATTHIS @tuckclinic.com. So the phone number to the office is on there if anybody wants to call. I love to help folks enjoy their journey. So if you have any questions, feel free to shoot me an email. I'm very responsive to email. I don't do the social media. I've decided that I don't spend my time not getting triggered by TikToks and all that other mess. But yeah, I'm very responsive to email. My bio is on the website. And if anybody has any questions, I'd love to take care of those as best I can. If I don't know the answer, I'll make something up till I can.
You'll make it up until you find it, right?
That's right. I will.
Dr. Matthis, thank you so much for your time. I've enjoyed having a short conversation with you. Folks, thanks for tuning in to the Bob Priest Show of Life podcast. We'll be back with you again next week. And thanks for tuning in and listening to our conversation. And I really want to encourage you to reach out to your local chiropractors and get to know them. They really go about what they do differently. And I love the way that they communicate with their patients because I've seen it, I've experienced it, and I've seen a lot of happy people come out of their offices but not come in so happy. So they've definitely done something correct when they got in there. Thank you so much again, Lee, and we look forward to seeing you soon. And guys out there in podcast land, have a great day.